Welcome to a Wiser Retirement Podcast. Before we get started with the episode, I wanted to let you know about a new free ebook available on our website. This ebook goes over the top reasons most financial plans fail and covers what a quality financial plan should consist of. The link to download Top Reasons Most Financial Plans Fail is listed in the episode notes. Now on to today's episode.
Welcome to a Wiser Retirement Podcast, where we believe the best financial advice should always be conflict-free. I'm your host, Casey Smith. Today, I'm joined by special guest Logan Steele from Steele Choice Insurance. Today, we're going to talk about key things to know when enrolling in Medicare. Hey, Logan.
Hey, Casey. How are you?
Good.
Good.
So, for our listeners, this is one of a few Berry College grown podcast now.
Awesome.
So you're a graduate of 2004,
2004.
Right?
Yeah.
I graduated in 2000. Robert Swarthout, who comes on and does the crypto edition of the podcast, he was 04 as well.
Yeah. Graduated together. Yeah.
So yeah, small world.
Small world. That's
I think
awesome.
we have some Berry
need to
listeners,
make it a thing.
Berry listeners out there. If you don't know about Berry College, it's up in Rome, Georgia, 28,000 acres of land.
I think that's still
and
what
about
it is now.
2,000 students.
Yeah. Yeah. It's what, like 10 deer per student, something like that. Yeah.
That's right. Chick-fil-A has a pretty big presence on the mountain campus, but it's a beautiful campus. It's usually in the top 4 prettiest campuses in the world.
Yeah.
And people go, Rome, Georgia, no way, but you need to go there.
You need to go there. I guess it still has the title of the largest campus in the world.
It still has the largest campus in the world. Yeah. But yeah, it goes from 1 to 4 as far as, and you think about there's some really pretty colleges, and you wonder how that's possible. But yeah, they can put on a good show. The Ford buildings, all made of stone by the Ford Foundation, or that was redone maybe 8-9 years ago, I think, by the foundation.
Yeah.
Anyway, it's a great experience, great college experience for me.
For me as well. Absolutely. Yeah. Great school. Have a lot of really good friends still hang out with from Berry. So
I've kind of gotten back into the saddle again on my aviation background, and I was doing a little flight training with a client of ours and Delta A320 instructor Bill Hall. Hi, Bill, if you're listening. Anyway, we flew up to Rome. What day was that? On Saturday afternoon.
Oh, perfect day to fly.
And of course, I'm concentrating on doing this, practice instrument approach. And my 11-year-old's in the back seat. And I said, "All right, Owen, you got to take a picture of Barry as we're going over." And there was no picture of Barry. I don't know. He had one job, right? He had one job. I didn't even get to glance down, but I told him we'd go back and sightsee later and try again. But he sent me some picture of it was like a high school and a soccer field. So that's the football field right there. And I'm like, no, that's not right.
I mean, Barry is like half of Rome. Like, how can you miss it?
Right. I know how you can miss it.
You have to make it back.
He got a picture of downtown. He did get that.
Okay. Nice.
All right. So we think about Medicare and we think, oh man, that's kind of boring, right? But you might think that, but when you start enrolling in Medicare, or you're trying to help your parents or your grandparents enroll in Medicare, you might need to know a few things about it.
It can be overwhelming. It can be very overwhelming.
Yeah.
A lot of people to try to tackle it on their own. And
it's overwhelming just with all the postcards that our clients get in the mail.
Right.
In fact, even after you've had Medicare and you're signed up for Medicare, you have your supplement or your Advantage or whatever, and you get postcards saying, if you don't renew this card right now, your insurance gets canceled. And they end up signing up for multiple things. It happened to my grandfather. Somehow he got signed up in a whole different program. He has no idea how he did it.
Sure. I get those calls every week. I feel like the marketing has increased dramatically, especially since 2020.
Yeah.
I mean, it's, everywhere on TV, you see these commercials and Joe Namath and everybody else out there.
That's
everybody
true.
Gets their cards in the mail and phone calls. It's funny because there's actually a lot of heavy restrictions on Medicare marketing, but it just seems to go by the wayside because they find loopholes around it. So Medicare's marketing is it's relentless.
Well, sometimes it's almost borders on the line of elder abuse. Really,
I agree.
You get so aggressive, and
I agree.
Doing that.
I had people call me every week, and they got enrolled in some plan, didn't understand the benefits, thought they enrolled in something else, and come to find out, it's not covering what they thought it was going to cover.
Right. So tell me about your business and how you got involved in in doing this?
Sure. Yeah. So I actually started right out of Barry in the insurance business with a company for about 2 or 3 years. And it was a business model where you either kind of move up and, recruit other folks in, or you kind of move out and do your own thing. So I started my own agency. So I deal with Medicare, but I also work with a lot of clients for small business, setting up their employee benefits, work with a lot of individuals that are under age 65 for their insurance. And it's been a good model. So I stay within the health and life realm, don't delve into, auto, home insurance, any of those, but
right. No annuity sales.
No annuity sales. I have enough on my plate for sure.
Right.
So, so I've been doing that solely for, about the past 18 years, and Medicare about the past 15 of that. I mean, it's changed dramatically. I mean, just in the short time that I've been doing this, every year, I mean, just like it is in your business, and we have ever-changing rules, regulations that are coming out. So really, Medicare is certainly not what it used to be 10 years ago, let alone 5 years ago. So it's something that you really have to stay on top of. It's a lot of people kind of think of Medicare as kind of set it and forget it. They might be in their 70s or 80s and have had the same plan since they turned 65.
Right.
And they should be looking at options, make sure they're on the right plan. There's a lot more out there that wasn't out there, 5 or 10 years ago. A lot more regulation, a lot more plan options that are included.
Yeah. Any idea how many total plan options there are? To me, it seems like there's like hundreds.
It seems
different
endless.
Variations.
Yeah, and I mean, a lot of it really depends on the area someone is in as well. I mean, you do see these TV commercials like we were talking about that says, check your zip code, but it does make a big difference. I mean, you're going to see a big difference in plan options from one state to another, let alone from one county to the next. So we're here in, Cobb County. The plans that are available in Cobb County are very different than the plans just available in Fulton County and one county over.
Right.
So, when you hear kind of blanket statements on someone should choose, X plan or Y plan, and that's best for everybody, that's really not the case anymore. Everybody should be looking at their own individual options based on the options that are available, where they live in their own health situation.
The same way of financial planning, there's always the rules of thumb, but in the end, it's really your specific plan.
Right.
It can vary. What's good for one person is not good for another necessarily.
100%.
Yeah.
100%.
So when do you think that someone should start looking at Medicare for themselves and their spouse?
So, general rule of thumb, I tell my clients 6 to 12 months, and 12 months might sound like a long period of time to consider that, but really you want to look at that transition, right? So sometimes it's just as important to set up a plan prior to coming on Medicare as it is when you're enrolling in Medicare, right? So looking at that timeline. So that's one of the first things that I walk through with my clients is looking at that timeline. Okay, is there a spouse involved? Are they currently employed? Are they under a corporate plan? Right. If that spouse moves to Medicare or vice versa, what plan options are available for the other spouse? So really looking at that timeline and kind of evaluating that if you're going out 12 months is a good place to start. But for a lot of people, 6 months is enough time. We can start looking at what needs to be done when. Should they enroll in Part A? Should they enroll in Part A and Part B?
Right.
Do we look at Medicare Advantage? Do we look at Medicare Supplement? And go through that process? Because
people working longer now past age 65, that kind of varies too, right? If they're going to stay with their employer, what their employer is, their employer primary, is it secondary? That gets people confused. Sometimes their own HR department's confused about.
Many times. Oh yeah. Many times, you might have a very experienced HR person, but when it comes to Medicare, it's a completely different world. And that's even the case for a lot of, insurance brokers that don't deal in Medicare. Honestly, most of my referrals come from other insurance brokers that don't deal with Medicare. So it's a very specific topic.
So are you not automatically enrolled at 65, or you have to take action?
It depends. So if somebody is already receiving Social Security, so say they start Social Security early, prior to age 65, then they're automatically going to be enrolled in Medicare. However, they would have the option to opt out. So if somebody's taking Social Security and they might still be working, probably not many people in that category, but in that case, then it might make sense for them to opt out of Part B. So you have Part A and you have Part B. Most people are familiar with those. And, very general terms, Part A is for hospital coverage and Part B is for the doctors. That's an oversimplification, but a very easy way to remember it.
Right.
So most people, if they've been working for at least 10 years, have those credits in the United States, they're eligible for Part A at no cost. So most people will take Part A, regardless of whether they're still employed and receiving benefits through their employer or maybe through a spouse's employer. It usually makes sense to take Part A. You get that, quote, free hospital coverage. However, there are some times where it makes sense for them to opt out of Part A. Not many, but one of those major factors would be if they are contributing into an HSA plan. So the IRS says you can't contribute into an HSA plan for that year that you also have any part of Medicare, whether it be A or B. So really it comes down to a decision. Does it make sense to take free hospital coverage, or would you prefer to contribute into a HSA plan?
Yeah.
And some people opt for the latter.
So do you just go to the website, to the Medicare Social Security website? That's where you sign up?
There's a few ways to do it. For somebody just kind of coming in at age 65, it usually makes sense for them to go to the website. They've made it a lot easier. So you can go to ssa.gov and enroll. Certainly help my clients out with that. Most agents are going to be able to kind of assist their clients with that process of enrolling in A or B or just A. They can go into the Social Security office, which quite honestly, a lot of my clients are pleasantly surprised when they go into the Social Security office that they can get some, good, helpful folks that do this every single day that can walk them through the process of it. If someone is enrolling, say, after 65, so those, employees that are continuing working, into retirement, say in their late 60s, 70s, and they have just enrolled in Part A, then the process for enrolling in Part B is different. So basically, you need to get a request for employment form from your employer to state that you've had credible coverage since you turned 65, and in order to avoid those late enrollment penalties.
Yeah.
So there's a lot of people I've talked to that, they've enrolled in B and they, missed that filing, missed those forms, and they're hit with a late enrollment penalty, and it can be kind of difficult to reverse.
Yeah.
So it's important to do that, in the proper channels.
So you have to have coverage somewhere. Either you
have to have coverage somewhere.
Got enrolled in Part B at 65, or you need to be able to prove that you're enrolled somewhere else.
Yes. Yeah. So you have to show that credible coverage. Yeah. That's the same for prescription drugs. So Medicare is going to put prescription drug coverage as a separate category. So not only could you be penalized for enrolling late into Part B, but you could also be penalized for enrolling into Part D, which would be for drug coverage.
Okay.
Yeah. Usually they go hand in hand, but not always.
And the drug coverage, I see advertised at CVS, is that good enough?
Sometimes. So if it's advertised at CVS, so like a drug discount program, so GoodRx, a lot of my clients use GoodRx, which is a great program. There's plenty of drug discount programs out there. And I tell my clients, regardless of whether they're on Medicare or not, they should be looking at those discount programs. You can just go online, you can type in that medication, put in the dosage, and it'll tell you where to get it the cheapest. I mean, this is what we need in our healthcare system, is this price clarity. It's one of the biggest problems that we have.
So what's the penalty if you don't sign up for the drug or Part B?
It's different. So if it's a Part B late enrollment, you didn't have any sort of credible coverage, then they charge you 10% of that Part B premium for every year you go without it. So
what your income is, that could be pretty hefty.
It could be. Well, so they'll look at the standard rate for this year, which is $164.90. That changes every year, but in 2023, most people are paying the $164.90. So, each year they go without any sort of coverage, paying $16, $17, and that's every single month. So certainly it is important to look at that early to either verify that they have had coverage or, go ahead and enroll in Part B. Yeah. And then for Part D, for prescription drug coverage, they have more of a complicated metric, but they look at the average national cost of a plan, which today is around like $34, $35. And then they take 1% of the cost of that for each month you go without coverage. Okay. So it works out to about a $4 per month penalty for each year someone goes without coverage.
In Part D.
In Part D, yeah, in Part D. But that's where IRMA kind of comes in play as well. I know you guys have a podcast on that I listened to, which was very well explained. But IRMA, basically for higher income earners, they're going to pay an extra amount for their Part D and for their Part B premiums. So
based on your income.
Based on your income. So they go back 2 years. So 2023, they're looking at your 2021 filed tax return. You can appeal that. A lot of people don't know, but you can appeal those IRMA premiums.
That's right. There's a form.
And a few different scenarios, but
usually work stoppage helps.
Work stoppage, yeah.
What we struggle with is large IRA withdrawals. So we're really big on being debt free in retirement. So we'll pay off someone's house, but that's going to put them into higher IRMA for 2 years, right? And so we try to say, hey, no, this is a one-time withdrawal related to retirement, and I think we're like 50-50 on whether it gets accepted. It's almost like just the person at the counter.
And that's the same thing that I tell my clients. It's really just who's looking at it.
Just keep asking.
So what I have had pretty good success with is when someone is turning in that IRMA form, just make a little cover sheet, right? Just kind of explain the situation, explain their personal situation. I've had a much higher success rate of those getting approved than just sending in a IRMA appeal form.
Okay.
So something to consider. But I'm glad you guys are doing that. There's a lot of financial advisors I've spoken with that don't even know about IRMA, let alone are they factoring that into their financial decisions.
Yeah.
So it can make a big difference.
Now, in our tax planning with our clients and our software, it'll start turning red when we do withdrawals, and it pushes up their withdrawal. They'll push them over the next threshold.
Sure.
So you have to be careful of that, because I think that what's the highest you could pay? It's pretty high income, but isn't it like $500 a month or something?
Yeah,
like
it's
that?
over 500 this year. Yeah. So
you got to be what, 400,000 plus?
700. So they've changed it a little bit every year. This year, 750,000
is the top
as
end.
A couple.
Yeah,
if you're filing a joint tax return is the max amount. So I think don't quote me exactly, but it's like 540, 537, I think, something like that. That's for your Part B. And then you have an additional amount for Part D. So that really comes into play when we're looking at someone that is, still working.
Yeah.
Usually if they're going to be a higher income, then a lot of times they're still working, and it may not make sense for them to enroll in Part B because they're having an extra premium. So you can avoid that that IRMA amount if you just delay your Part B enrollment in Part D.
Yeah.
Might make sense to just continue with your employer plan, even though it's, still may be costly to do so.
Right.
Yeah.
That's why it's so important, even when you're young, is to start saving money in the right categories. So you have like Roth 401k, you have Roths outside that, and then you have brokerage account. And so for a lot of people, it's high income earners now, you want that tax deduction. So you do everything pre-tax, but then when you say, well, I've got this extra, where can I park that? And that's where you do it. Just do a brokerage account, not an annuity, just put in a brokerage account. So when you roll into this situation, you can live, you can pull some from the brokerage, some from the IRA if you needed to, and you keep your income, your taxable income below that threshold. So you don't have to pay those higher premiums. Where, occasionally now we get people who save their entire lives all pre-tax in their 401k. And now it's all taxable when it comes out, and they don't have any other savings, and so you don't have the ability to kind of control your tax liabilities.
Yeah, absolutely.
And so that's just another example of where planning now makes a huge difference. 20, 30 years down the road, even 10 years, you can make a difference if you worked hard enough at it.
Yeah, and I mean HSAs are a great tool for that as well.
That's right.
Yeah,
that's
so
right.
with
Because they can pay all the premiums for the
Yes.
supplemental policies and advantage policies.
That's right. Yeah. So, which is untrue for, people under age 65. You can't pay the premiums for your health insurance plans. That might change, but as of now, you can't pay your premiums. But once you get a Medicare, you can. So, and you have that extra catch-up provision as well.
Right.
So that works out well for a lot of my clients that are, healthy and good shape. They're able to save some premium dollars by choosing one of those plans. That would be HSA eligible leading up to Medicare.
Right.
So again, that's why kind of going back to our first question there about leading up to Medicare. It's an important decision. So for a lot of those, it makes sense just to go ahead and go in an HSA.
So let's break down all the choices. So
sure,
I've seen clients that have free plans. Now I'm talking about supplements. So we've got Part A, we've got Part B,
right?
But then we get turned into alphabet soup. right after this, and it gets very confusing. Right. Even for us here, we have to refresh ourselves occasionally because it's like, okay, what's a G plan?
Right.
Right. I think you commented something last time you were here, like an N plan or something like that.
An N plan.
I didn't even know what that is. I just look at it as Medigap or Advantage. That's what it has in our financial planning tools, and we know that Medigap covers more and Advantage covers less, but it's cheaper. Do I have that right?
For the most part, yeah, absolutely. I mean, there's going to be a trade-off there. But
is that where the donut hole comes in under Advantage?
Donut hole comes in under a prescription drug plan, which can be an Advantage. Yes. So, basically to break it down, you have two main categories that most people are considering when they go on Medicare. Are they going to go with a Medicare supplement or are they going to go with a Medicare Advantage? Now they might continue with a company-sponsored plan as well for a period of time. But
let's assume they're just retired at this point.
If they're retired, then Advantage or supplement. So in the supplement category or Medigap, as you mentioned, same thing. There's so many different terms that go by the same product, but you still have the alphabet soup even within Medicare supplement plan. So. You can have an A plan, you can have a B plan, you can have a G plan, an F. A lot of people are in F plans still, even though those have gone away. But basically, the nice thing about those is those are standardized plans, right? Okay. So they're going to be the same core benefits from one company to the next. So they're a little bit easier to compare apples to apples. Mm-hmm. If you're looking at a G plan with Humana versus Mutual of Omaha versus Blue Cross Blue Shield, as an example, they're going to have those same core benefits. Now, they might have a few kind of bells and whistles in addition to it, but they're going to work alongside Medicare.
So, is there one plan that just is like the best of the best?
I mean, right now...
does it just really depend on what medications you're on? Is that what it comes down to? Or how often you go to the doctor?
There's a lot of factors that go into it. So if we're looking at, whether it makes sense for somebody to go with a supplement plan or an Advantage plan, there's not a one-size-fits-all. I mean, you see a lot of people out there that'll say, everybody should go with supplement. Everybody should go with Advantage. And I think that's really kind of copping out on, especially like an agent's responsibility. So I present, both options to my clients. We go through the pros and cons. And like I said, it's always changing. So what might've been true, this year may not be true 5-6 years from now. So something you have to really take a look at. But so you have supplement and Advantage. With supplement, basically you pay a higher premium typically than you would with a Advantage plan. However, you would have that plan pick up all or most of what Medicare doesn't pay for, right? So with Medicare, original Medicare, they'll pay about 80%, again, an oversimplification, but you have deductibles and you have coinsurance, but you're paying about 20% of the cost. Yeah. And there's no cap to it. So at the end of the day, that is the main reason that you need either Advantage or a supplement is to put that cap on your out-of-pocket expenses.
Right.
And most people don't know that there's not many people that have just original Medicare, but there are people out there that do, and they need to look at, one of those options. So either plan is going to be a high level of coverage, whether you go with supplement or Advantage. Again, and I know I'm bouncing around, but with the supplement plan, again, that's going to be for medical. So it'll pick up all or most of that cost that Medicare doesn't pay for. And then you would have a standalone prescription drug plan, typically.
Okay.
Right. So kind of describe it as like insurance a la carte.
Yeah.
Right. You get to have Medicare as your base, and then you fill in those gaps, whether it be with a, Medigap plan, say a plan G, which is kind of the go-to right now. It's kind of replaced F. Okay. F plan, I won't get into all the details, but F plan basically covered everything, including the Part B deductible. But we don't have the F plan anymore unless someone was eligible when the F plan was still around a couple years ago. Right. And then you would have a prescription drug plan. So you'd have if you went with G, you still have prescription on top of that, or that includes G? You would have prescription on top of that. So in physical terms, you're having 3 cards in your wallet. You'd have your Medicare card. Yep. You'd have your Medicare supplement card. You would show that when you go in for a doctor or hospitalization, and then you would have a separate prescription drug card that you use at the pharmacy. Yeah. And prescription it's a big component. It really is. I mean, it's one of the highest cost for seniors' healthcare expenses. Yeah. So, I mean, I really spend a lot of time, going through, individuals' medications, looking them up, seeing which plan, because not all prescription drug plans are made the same. Right. There's 2 ways you can receive prescription drug coverage. Either the method I just mentioned as a standalone prescription drug plan if you're going the supplement route.
Yeah.
Or you can get it included with a Medicare Advantage plan. So Medicare Advantage is basically an all-in-one plan, right?
Okay.
It's going to cover your A, your B, your Part D. You're going to have co-pays to that. But I would encourage, anybody that's kind of coming into Medicare, make sure you're looking at your prescription drugs and running that analysis. You can go to Medicare.gov. You can plug in all your medications. It'll spit out a report that shows the co-payments under each plan, so you can cross-reference that real easily.
Yep.
But I would say in my experience, don't trust that 100%. You want to go through those extra steps of, can I get this cost of medication cheaper outside of my insurance plan? Yeah. So going back to what we were talking about with like the CVS plans or GoodRx discount programs, you want to factor those in as well. So you might have a medication that say is a tier 4, and under the plan, that tier 4 has a $100 copayment, but you can get it at CVS with GoodRx for $4 or $5.
Yeah.
So that can make a big difference for sure.
So shifting gears just a little bit, learning all this is one thing, but as you age and you start having to go to the doctors more often, I'm astounded by the wait times. Did your clients talk about this? Like they needed to go see a cardiologist and they found a really good one that everyone says is the best, and it takes 6 weeks to get in.
It's tough.
Do you see that?
Absolutely.
Is that?
Yeah, I see it across the board. So whether someone's on Medicare or not, it can be difficult. I mean, especially in more, metropolitan areas, we don't have enough physicians. So yeah,
enough good physicians.
Yeah. So it can really be a long time to get in. That's another thing too. So if someone is, kind of transitioning or looking to transition to Medicare, in the future, establishing those relationships as early as you can is important. There's a lot of physicians out there, they say, we're not going to take you as a new Medicare patient. You have to be an existing patient in order for us to see you and take Medicare.
But then let's make it more complicated. You have cancer, and but yet you have other complications. You have to go see multiple doctors. Mm-hmm. Who's coordinating all that?
Yeah, good question. So if we're just talking about Medicare, that's going to make a big difference on whether someone goes with Medicare Advantage or Medicare Supplement.
Yeah.
So, because you're getting into networks. So most people, if they're coming off of a group plan or say they had individual coverage, they're used to having an HMO or a PPO, right? So with a PPO plan, you have that flexibility. You want to continue seeing those doctors that are in network that partner with the plan. However, you do have that flexibility to go out of network, but you're going to pay more for it, right? With an HMO, you have to stay in network. So when we look at that through the view of Medicare, if you're going with a Medicare supplement plan, the nice thing about Medicare supplement plan is there's no networks. So with Medicare, as long as that provider accepts Medicare, then you can use your Medicare A and B plus the supplement with that provider. So people that I'm speaking with that want that level of flexibility, they want to go to, Mayo Clinic, MD Anderson, any of those specialty, places that, provide, higher level of coverage maybe than, what they might have locally.
Yeah.
Medicare supplement could be a very good way to go. That's probably the number one reason somebody would choose a Medicare supplement is have that
flexibility.
For that flexibility.
Where the Advantage is more like an HMO.
So Advantage can go HMO, PPO. There's a few different other categories, but most people, if they have Advantage now, are on a PPO plan.
Got it.
So it still gives them a level of flexibility.
Yeah.
But again, they're going to be paying more if they go out of network. And then there's just some providers, they say, we won't even take you out of network. We're not going to file the claim. Now they still might be able to get some reimbursement for it, but it's not a ideal scenario.
I'm starting to get phone calls from services that help people with coordination. I talked to one a couple of weeks ago. They're not doctors. Well, they are doctors, but they're not treating you specifically. They're as in looking at you. They're managing like the paperwork in the back office, and it went from $5,000 to $15,000 a year per person. Mm-hmm. And the whole point was, okay, I'm run into something medical wise, it's becoming, it's kind of a burden. I'm not sure which doctors to go see. They'll vet and research doctors in your area or out of area. And they'll say, okay, these are the best people. And then they coordinate all these people in the background to make sure everyone's talking, everyone's understanding what's going on. Because that's something that I've seen in the past, where there's been very poor patient care. Maybe it was a good surgery, but beyond surgery, there was just no care for that person because doctors and staff don't have time for that anymore. We even have locally, it's not just in Atlanta, it's everywhere, MDVIP, where you pay $475 a quarter, but your doctor that you pick, there's 3 here in Marietta, your doctor that you pick won't have any more than, and it varies by doctor, some 250, 300, 400 patients, which you think about, a normal doctor has thousands of patients, and they probably have at most maybe 10 minutes with you, where the MDVIP doctors for that you just pay with your insurance, right? Like you normally do, but they'll sit down. I know when I go in for my physical, I might be there for an hour and a half. He probably spends 45 minutes to an hour with me, where that's unheard of.
That's unheard of.
Unless there's something really wrong with you, right? It's just something that I've noticed through family members having to go through medical right now. Yeah. Even just, I was out skiing with the kids a few weeks ago, and by the way, public service announcement: when you're 45, don't follow the 11-year-old down the run because they do things that you can't do.
I made that mistake.
and I ended up on my landed on my shoulder, and it's still not quite right. But the best orthopedic surgeon probably in the South, Dr. Brad Bushnell. It's actually at the Harbin Clinic up in Rome.
Okay.
He's on the board of trustees at Berry College. That's how I met him.
Nice.
He's like literally the smartest guy in the room. And I don't mean that in a negative way, right? And so I called him up. I got up to see him like 2 days after I got back. Well, I made the mistake of calling the main line first, thinking I don't want to text him about this. I'll just make an appointment. The appointment was like in April,
right?
And it was February,
right?
I'm like, oh my gosh, what is wrong with this system? That if you don't know the doctor personally, it's going to take you 6 weeks to get in there. And then I just so happened to get an email from this service, the one I was telling you about. I did not personally hire them. I typical man, I don't go to the doctor unless I absolutely have to, right? Yeah. but it just got me thinking. It's like, man, this is a real problem.
Sure.
I've read articles about doctors down in Atlanta that don't even take insurance. You just pay cash.
Yeah.
And it's a whole network of them.
Sure.
And you'd be amazed how cheap it is, relatively.
Right. No,
now they're not doing surgery; they're just doing healthy stuff. But
right.
I don't know. I know that you're on the front lines of this because you have clients probably calling you frustrated.
They are, they are. But it's a big challenge. But all the services you just mentioned, I mean, it kind of shows the need to access to care. So that is certainly one of the biggest problems that we have. I mean, there's a few things they can do. I love the MDVIP, service for people that are in a financial position to do that. That gives you, frontline access to care. You can text your doctor, you can call your doctor.
Yeah, that's right.
You're going to pay a fee for that.
Sometimes they'll come to your house.
Yeah, come to your house. I mean, that's excellent. You're starting to see, more of that when it comes to, some Medicare Advantage plans where they're trying to provide that extra, access to care. So that's going to come in a few different forms. The biggest thing right now is telemedicine, right?
Yeah,
so,
true.
Since 2020, that has been a, big access to care for a lot of folks. Now, obviously that's not for everything, but if you just need a provider to, write a prescription, in certain case, that could be a good method to go with. You have other Medicare Advantage plans where they're having access to in-home health, where you can have a provider come out to your house. They can do primary care office visits, standard physicals.
Right.
They can run blood work. So we're starting to see more of that as access to care, especially people that have mobility issues. I mean, it's an excellent way for them to get that extra access to care. You're also seeing some Medicare Advantage plans provide transportation, right? So they can get out and see those providers. But really, access to those top providers, it's always going to be a challenge. It's a supply and demand issue.
Yep.
And we just need more providers out there.
But for people who have means, which are most of our listeners,
sure,
to me is like, how do you get to the front of the line? Like the bottom line is that,
be persistent.
It's much like being on an airplane.
Yes.
And there is the cheap fare in the back next to the restroom.
Yeah.
But there's also, and this is a bad analogy because first class is not what it used to be, but but there is a boarding priority, and it shouldn't be that way. Our family, one of my family members had a kind of a botched experience up here at Wellstar here locally.
Yeah.
And that's one of the things I kept telling the hospital director was, this shouldn't happen. And the fact that, one, it shouldn't have happened to my family because I'm supposed to be, on the on the front of the line here.
Right. Yeah.
and second of all, it still happened. And if it happened to someone with hardly any means whatsoever, they would have had no voice,
right?
Zero voice. They would have been stopped at the nursing station. And I was so mad because one that was happening and my family member was in a tremendous amount of pain unnecessarily. And then two, that, okay, what about everybody else? And what was, who would have been their advocate? Nobody.
Right.
And so it's we already know about nursing homes. We know with nursing homes, you need to like never go see your loved one at the same time every week. We know that you need to go randomly, because if they pick up your pattern, then they'll kind of let your loved one go by the wayside.
Interesting.
because there aren't enough to service all the people that are there.
Right.
So we found that if we just go sporadically, that we can, I feel like they get better care because they don't know when they're going to be inspected. Right.
Sure. My clients that have the best success with that, whether it's receiving care for themselves or for a family member, is you just have to be persistent. I mean, you have to stay on them. That's what we have in our healthcare system, but
correct. But that goes back to my point of you have to advocate for each other. Each spouse has to be advocating. But if you're both down and out and you both need care, or you're a widow, you have to have a loved one advocate through the process. I'm the worst patient ever. I go in my wife would say, well, what did they say? I don't know. Right. Well, did you ask this question? No, I didn't think about that.
Yeah.
Right.
I get it. I know us guys can be that way. Yeah, I agree.
So you have to have someone there with you, listening, taking notes, asking questions.
Right.
Because the people who are responsible for your care are also responsible for thousands of other people, and you're just a piece of paper. You're just a piece of paper, and it's frustrating. It's frustrating. I'd still think we don't have the cheapest, but we still probably have the best care. People are coming here.
People are coming here. Absolutely. I mean, we have, some of the highest quality care, but we are spending far more per capita than I think any other country,
right,
by far.
Right. So there's just going to continue to be a rise in services that are catering to the higher net worth individuals.
Yeah.
To make sure that the ball's not being dropped.
Right.
That medications aren't conflicting with each other, and that people have multiple issues are being addressed, or even just people go, something's not right, but no one's taking the time to go figure it out.
Right. Yeah. And a lot of those problems I think can be solved eventually. I mean, we're getting to a point where a lot of these, systems that are in place, whether it be the hospital or the pharmacy, they're out of date. We've kind of moved more to a model where, electronic health records are going to be required, but I think we're just kind of tipping we're at the tip of the iceberg on that. There's so much more that can be done there. And, HIPAA, although has some, strong benefits to it, it can kind of get in the way of that progress, in my opinion, for, really pushing forward to kind of our next generation of how healthcare is going to be. And I mean, technology is going to play a huge role in that.
Do you think it ends up being universal healthcare at some point?
So my opinion, kind of what I have seen, looking at the different segments, both Medicare, individual coverage, and then also with group, is I see a lot of signs that we're going to be moving to like a Medicare for all type system. Taking my personal belief about where we need to be, I'm seeing the writing on the wall. That's where we're going. And we were talking about even, Humana the other day. So Humana is one of the leaders for Medicare, both in the supplement and the advantage space. And they're getting completely out of the business of group health insurance. I mean, a massive part of their business, they're just completely getting out of.
Yeah.
So they're going to be focusing on Medicare. I mean, it's just kind of one small example of it. But you're seeing with ACA as well, But, Medicare is continuing to get stronger and stronger. There's not, any politician out there that wants to, touch Medicare in a bad light. Medicare and Social Security, those are your third rails when it comes to
Without those two things, the U.S. would look very different than what
it would look very different. Yeah. So I think we'll press forward. We'll probably still have carriers that are involved, unlike a universal health care, where universal health care, meaning like a Canadian type system, right, where the government is both supplying and employing those providers. Our model would not work like that in the United States. So rather kind of having a one-payer system like Medicare, a system that's already in place and can be expanded on. So we might see something as in, reduced age for individuals that are eligible for Medicare. Right now it's 65. What's to say that shouldn't go to 62? I mean, if you could take Social Security early at 62, why shouldn't you be able to take Medicare early at 62 and pay into it? Yeah. And then depending on where your income is, maybe you just pay a smaller portion of it. So
interesting.
Yeah. So that's where I see us going. So those, Medicare Advantage type plans, I think those will continue to expand because, the government agencies, hiring as many people as they would need to facilitate all of the administration of it isn't going to happen. They're going to do like what most government agencies do, is outsource it, right? So they're just going to outsource it to an insurance company, just like they're doing now with Medicare Advantage. So you're starting to see those plans, continue to rise. It was, a very low percentage, even, 10, 20 years ago for Medicare Advantage. And generally speaking, Medicare Advantage is fairly new in the marketplace, but you're seeing, far more people enroll in Medicare Advantage now than what we've seen before. And it's this snowball system, right? Because you have more people in the plan, then you have more providers that accept the plan. And because more providers accept the plan, more people enroll in the plan. Right. So right now it's about, different studies, 45 to 48% of people are enrolled in Medicare Advantage plan. It's probably a lot higher than most people would guess.
What about small business owners? So we see an increase of about 15% a year in our premiums.
Yeah. I mean, ACA has changed a lot of that. So ACA was signed in 2010. 2014 is when the meat of it went into place. And that has made a major change for small business owners. Any groups that are under 100 employees, it's difficult. It's a significant part of their budget to, factor in health insurance benefits, and employees are really looking for.
That's because they're required to carry insurance below, what's the
50.
number? 50. 50 you have to offer insurance?
Yeah. I mean, there's been a lot of changes since AC on that, but we still have that in place.
Yeah. Where some small business owners, when that came in, they canceled their insurance and said, here's some money, go to the
exchange. Yeah.
Which I could never do that to our people here, but
yeah. I mean, the exchange plans have gotten better, but it was tough there for a while, in 2014.
I don't know. People tell me that on the exchange plans that some doctors won't even see them still because it takes them so long to get paid, I guess.
Yeah. I mean, right now, part of it is what we have right now in Georgia, at least, for 2023 is mostly all HMO plans. So HMO versus PPO, and really those providers are going to prefer to take a PPO plan. So yes, that you have a lot more network restrictions on ACA plans, but for small business owners, there's a few things that they can look at. We've started seeing more what we consider like level funded plans, which is a version of technically a self-insured plan. Okay, which you would usually have for a larger business. Any publicly traded company, for the most part, they're going to have a self-insured plan, right? They're acting as the carrier. They're just having a insurance company that's managing everything. Right. But the funding is coming from the client, from the employer. So you can see that on a smaller group basis. So rather than having kind of level rates that are going to be just based on your age, tobacco status, where you live, they're now looking at your health condition. So you're more rewarded, I guess you could say, for, individuals that are, maintaining, healthy lifestyle living, using their plan appropriately, not going to the emergency room when they could be going to urgent care. Yeah. So it's making employers more involved when it comes to what plans are going to be offered. And then also really just the healthcare of their employees rather than just kind of throwing out a plan, take it or leave it.
Yeah.
It's become more of a collaborative effort with things like wellness programs, right? That usually you would just see on larger businesses that you're now seeing on smaller businesses. But a lot has changed in that space for sure. So, any business owners that are listening to this, they probably should be, looking at options because you can look at a massive savings just by making a few changes to the plan and the structure.
Interesting.
Yeah.
Well, Logan, thank you for your time today. Any last words for those approaching Medicare?
Yeah, I would say, just don't be overwhelmed with it. I mean, there's a bunch of options, but like I mentioned, at the end of the day, most people find that their options available on Medicare are going to be higher than the coverage that they had before, whether it be through a spouse's plan or individual plan or through their company plan. So yes, it can be an overwhelming process. I mean, of course, I would advocate, have a licensed, competent broker that's able to look at multiple different plan options, that knows the plans in your area, that can help you through that process and, answer some of the questions, even if you've done the research that, you'll probably get a lot of good insight on.
And how do they get in touch with you?
Sure. Yeah. So they can go to my website, steelchoice.com. I have a link on there where they can schedule a free 30-minute consultation. Of course, they can call, text, email me at any time. So I try to make myself, pretty available. Work in the Southeast. Most of my clients are in Georgia, Metro Atlanta area, but I also help out clients all over the Southeast.
Okay, great. Thanks for your time today.
Awesome. Thank you, Casey. Thanks for having me.
Thanks for listening to a Wiser Retirement podcast. We hope you enjoyed today's episode. Make sure to subscribe wherever you're listening. That way you don't miss any new episodes. We'd also appreciate if you could leave a rating and review. If you have any questions about anything that was discussed today, head to wiserinvestor.com and reach out. This episode was produced and edited by Ken Hoadley. This podcast is strictly for informational purposes only and is not to be considered as investment advice or a solicitation to buy or sell any financial products, securities, digital assets, or any other investment vehicles, or a basis to make any financial decisions. Wiser Wealth Management Incorporated is a registered investment advisor with the SEC. The host and/or guest may personally own securities, digital assets, or other investment vehicles mentioned on this podcast. Neither the host nor guest of the show are compensated for their participation, and no referral fees are paid to or received by any host or guest for clients, listeners, or similar interests. Investments involve risk, and unless otherwise stated, are not guaranteed. Be sure to first consult with a qualified financial advisor, tax professional, insurance professional, and/or legal professional before implementing any strategy discussed herein. Past performance is not indicative of future performance.